Thanks a lot, Kian. Good morning, good afternoon, everyone. My name is Rafael Petazani. I'm the Body on Co-Portfolio Manager for Philips MR and the Product Manager for SmartSpeed. I will talk to you about SmartSpeed, our new solution bringing MR to a new level in terms of speed and image quality thanks to AI. Philips had the track record in speed and parallel imaging since the 90s. It started with Sense, a true revolution for MR, and more recently, we developed our leading compressed Sense solution. Today, we are continuing on that journey, and we are very happy to introduce the next solution in terms of speed and image quality, leveraging AI deep learning reconstruction. And we will continue to innovate in the future based on this AI disruptive technology. You can appreciate here more than 20 years of innovation. Same acquisition, 4-chamber cardiac black blood imaging, Sense on the left, compressed Sense in the middle, and SmartSpeed on the right. Thanks to SmartSpeed, we will provide high resolution and pristine image quality for you, radiologists, technologists, and clinicians. But let's deep dive into our technology behind this solution first. We are using compressed Sense as speed engine for the acquisition part. This is our gold standard and a versatile compressed sensing-based solution, leveraging on Sense with the integration of coil sensitivity and background information. And this is what makes SmartSpeed so fast. Secondly, SmartSpeed leverages a deep learning reconstruction. And once again, you can apply deep learning recon all along the reconstruction pipeline, as you can see here. However, we opted to integrate our adaptive CSNet model at the source where information is the richest in order to maximize denoising while preserving every details. Our AI recon will be applied during the channel combination where you can integrate coil sensitivity, phase, and background information for each individual elements, allowing an on-fly consistency check via an iterative reconstruction to raw space data. This neural network is trained for all contrast and on a wide range of acceleration factor to ensure trustworthy output images from head to toe. Philips SmartSpeed is addressing your needs by taking the next step in scan acceleration while preserving diagnostic confidence and providing robustness for all your protocols. And with this new proposition, we will be able to use that would be normally considered as research or advanced imaging as more routine application with some direct benefits for your patient. And we will see some examples just after. First, by improving the productivity of your system. I would like to show you some evidence. And if you need to go fast, if you want to go fast, you can know. Look at this impressive brain from our partners in Tokyo. Scan time is dramatically reduced to about 15, 20, 30 seconds per sequence for a total of 2.5 minutes. And SmartSpeed is not isolated somewhere in the workflow. You can really maximize and combine all the benefits of our end-to-end solution, like Smart Exam, for example. You can also join different webinars on applied radiology if you want to know more about our workflow solutions. MR prostate imaging is now crucial before biopsy for patients at risk to develop a cancer. Combining our state-of-the-art body portfolio and SmartSpeed, you can really boost your diagnosis in less than 5 minutes for a non-contrast protocol, including high B-value diffusion. But you can also adapt your scan, reduce the thickness of slices, and improve the in-plane resolution, as you can see here with this dual inversion recovery brain sequence, Sense versus SmartSpeed. SmartSpeed can increase the resolution up to 65% to deliver an outstanding image quality for your diagnostic confidence in 2D, as here with the 1.5 2 mm slice thickness protocol. And I would like to thank Ben Kennedy from Australia Mermaid Beach Hospital for his collaboration. Now, this great example demonstrating the benefit of image quality via higher resolution and leveraging SmartSpeed compatibility with 3D, combining with our Smart Spine View Pulse. You can appreciate the quality of the reformat here without any blurring and high image quality. As said, SmartSpeed is not designed for few sequences in our portfolio, but also for complex ones like the diffusion-weighted imaging. Diffusion is used for many applications and is a major sequence for prostate, neuro, and liver exam, for example. Philips SmartSpeed Diffusion is designed to improve the SNR in order to shorten scan time by reducing averages for each B values, to improve the resolution, like in this example, or to reduce distortion. Thirdly, we need to make MR more accessible for every patient. Also, we know that especially in body imaging, motion artifact could directly impact the diagnostic confidence and leads to reading errors for radiologists. Philips SmartSpeed Motion Free removes the compromise between motion robust scanning on one hand and speed and contrast on the other hand. We can enable this technology for non-Cartesian imaging, as you can see here on the pelvis, addressing in fine a broad range of patients with our 97% compatibility to provide a fast first-time right imaging. Performing musculoskeletal imaging in patients with implants is always challenging. With the introduction of technologies such metal artifact prediction or MRXD in our protocol, image quality has substantially improved. With Philips SmartSpeed implant, the technology of OMR-XD is integrated into the pipeline to reduce the scan time significantly. But last but not least, and the beauty of this solution is to bring also new information available for the radiologist and the clinician in a very short scan time. You can now combine tissue quantification techniques with our new AI SmartSpeed engine. Quantitative MR is not new, like this T2 mapping on the knee. But as you can see, it was really difficult for our partners to have this kind of supplemental sequences in their protocol because of time, despite all the benefits. SmartQuant is actually making quantitative MR finally ready for clinical prime time in only 2 minutes and 34 seconds, as you can see here, with an excellent resolution and reliable quantitative value. Thanks a lot, and I'm very glad and honored to introduce our next speakers and partners, Dr. Barbara Wichmann, who is radiologist in Bonn University in Germany, and we will have just after Barbara Rüplin, who is clinical specialist in Wellstar,
Thank you very much.
United
It's an honor
States,
for me
Georgia.
to speak today about our
Barbara,
experiences with Philips SmartSpeed at the University Hospital in Bonn. So why Philips SmartSpeed is so important? Today's healthcare environment is shifting rapidly, driven by demographic change and economic pressures on the system. We as radiologists are faced with an aging and increasingly multimorbid patient population. So acquisition times need to be short enough that diagnostic scans can be acquired, even for patients that cannot lie in the scanner for a long amount of time due to pain or a low breath-hold capacity. Economic pressure on the system is high. Imaging plays an increasingly pivotal role in clinical therapeutic decision-making, so we are confronted with an ever-growing number of patients. The rate of non-diagnostic scans due to artifacts should be reduced as far as possible. Also, acquisition times should be faster while maintaining image quality. Philips SmartSpeed addresses exactly these points for us. It allows, as we've already heard, compresents beyond the Cartesian sampling scheme, and it uses a deep learning-based AI for better images, and we can apply it to 2D and 3D Cartesian sampling schemes of all contrasts. I want to start with Philips SmartSpeed within the prostate. The prostate protocol is a very standardized protocol. The conventional protocol at our hospital consists of high-resolution T2 weighted images acquired in a sagittal, axial, and coronal direction. We then acquire 3 diffusion-weighted images with b-values of 100, 400, and 800 to calculate the ADC map. We acquire a high b-value diffusion-weighted image with a b-value of 1,500, and then the contrast-enhanced T1-weighted images. The conventional protocol usually takes about 24 minutes. With SmartSpeed, we are able to reduce this to 17 minutes by 7 minutes. So while we are able to acquire or examine 3 patients with the conventional protocol, we can examine 4 patients with the Philips SmartSpeed protocol. My colleague Leon Bishop systematically analyzed Philips SmartSpeed T2 weighted images within the prostate, and he found that the Philips SmartSpeed images have a better image sharpness, a higher apparent signal to noise ratio and contrast to noise ratio, significantly reduced artifacts, and as already seen, reduced the acquisition time by 24 to 26%. I want to show you 2 clinical examples. On the left, we see the conventional sequence, and on the right, we see the Philips SmartSpeed sequence, particularly for patients that cannot receive Buscopan and have some contraindications. The bowel will move, and it will often cause such motion artifacts that, as in this case, often also run through the prostate. Seen here. With Philips SmartSpeed, we are able to reduce these artifacts and acquire artifact-free images with a higher signal-to-noise ratio, apparent signal-to-noise ratio, and contrast-to-noise ratio. This is the same patient as we've seen before. This patient has a Pirates 5 lesion within the left peripheral zone. On the left, again, we see the conventional sequences, and on the right, we see the Philips SmartSpeed sequences. We note the significant time reduction from 3 minutes 52 seconds to 2 minutes 43 seconds. And what we note is this lesion here in the peripheral zone on the left has a long contact to the capsule, and we suspect infiltration of the neurovascular bundle. But because the conventional images usually are a little bit blurry and are not as sharp, with the Philips SmartSpeed image, we are able to say that the neurovascular bundle is actually infiltrated with a higher diagnostic confidence. Same goes for the high B-value diffusion images. We achieve a significant time reduction because we are able to acquire less averages, from 18 averages to 10 averages, from an acquisition time of 3 minutes 32 seconds to 2 minutes. And here we see the 3 B values, 100, 400, and 800. In the top row, the conventional sequences. In the bottom row, the Philips SmartSpeed sequences. And again, we can reduce the averages we take per B value from B400 from 4 to 2 averages, and at a B value of 800 from 8 averages to 4 averages, and thus reducing the acquisition time from 3 minutes 35 seconds to 2 minutes and 5 seconds. This is just to show you that the calculated ADC map actually looks nearly the same. We do not lose any information. The lesion is clearly to be delineated here in the left peripheral zone, and we suspect the invasion of the neurovascular bundle. While we are very sensitive for lesions within the peripheral zone, we often miss lesions within the transitional zone. And I believe that Philips SmartSpeed actually has a big impact here. Here we see a patient with a Pirates 5 lesion here in the left transitional zone. Philips SmartSpeed will have a big impact in this area because these lesions are sharper and the lesion delineation is higher, while acquired in a shorter amount of time. Next, I want to talk a little bit about SmartSpeed imaging within the liver and pancreas. I'm often asked as a radiologist whether I'm afraid that by applying AI to reconstruction, for example, whether we lose information. And I can assure you that I've never experienced this. This is the perfect patient. He has a lot of biliary hematomas with a lot of fine lesions here within the liver. On the left, we see the conventional sequence with an acquisition time of 3 minutes and 18 seconds. On the right, we see the Philips SmartSpeed sequence with an acquisition time of 2 minutes and 24 seconds. And I want you to pay special attention to this area here. we see those lesions, and every lesion can also be delineated in the Philips SmartSpeed sequence, but actually sharper. Particularly, for example, this lesion is better to be delineated in the Philips SmartSpeed image. So I'm not afraid that we lose any information. This is a patient with a cavernosus transformation of the portal vein. Those tortuous veins are often very blurry in the conventional sequence. Within the Philips SmartSpeed sequence, they are much sharper, and we can follow all those fine structures here in the center. And we reduce the acquisition time from 3 minutes, 18 seconds to 2 minutes and 24 seconds. This is a patient with a hepatocellular carcinoma after treatment with transarterial chemoembolization therapy, here in this segment. And this is a patient that cannot hold his breath for a long amount of time. So we observe those motion artifacts, breathing artifacts, running right through a lesion that's right here subcapsular. And by the use of Philips SmartSpeed, those artifact lines are gone. We can clearly delineate this lesion. I mean, we can also delineate it here in the conventional sequence, but imagine a smaller lesion. You might actually miss it when such an artifact line runs through it. Same goes for the diffusion weighted image. We have a much better signal to noise ratio within this Philips SmartSpeed image, particularly here in the right lobe. We lose a lot of information here in the conventional image. And those artifact lines are significantly reduced in the Philips SmartSpeed image. And now, very important, we remember this lesion here subcapsular. We cannot delineate it in the conventional sequence, but we can actually clearly see it in the Philips SmartSpeed image. This is a patient with a solid pseudopapillary tumor of the pancreas. We have the conventional sequences on top and the Philips SmartSpeed sequences at the bottom. We see this lesion, and image sharpness is again increased from the conventional to the Philips SmartSpeed images. And for the diffusion weighted images, we can say that the acquisition time is reduced while image quality is the same. And the ADC value, maybe we can even delineate it a little bit better here. Next, I want to talk a little bit about Philips SmartSpeed and musculoskeletal imaging. These are patients that are usually in a lot of pain, so they tend to move a lot and they cannot lie in the scanner for a long amount of time. Shown are the conventional sequences with the Cartesian sampling scheme in the top row and the Philips SmartSpeed sequences with the multi-vein acquisition and propeller acquisition at the bottom. And what we see is a significant reduction of motion artifacts. Particularly, such tears can be much better be delineated here in the Philips SmartSpeed sequences. And what we also see is an acquisition time reduction from 2 minutes 52 seconds to 2 minutes and 18 seconds. You can also apply Philips SmartSpeed within the brain. Shown is a very young patient with an Ewing sarcoma. On the left, you see the conventional sequence, on the right, the Philips SmartSpeed images. What we often observe in the conventional sequences is this physiological noise, those kind of motion artifacts within the area of the basal ganglia. It's very blurry. For the Philips SmartSpeed sequences, these artifacts are significantly reduced. The basal ganglia are much better to be delineated. Also, we have an increased image sharpness and an overall better image impression. The acquisition time is reduced from 4 minutes 1 second to 3 minutes and 19 seconds. I'm not an expert in cardiac imaging, but nevertheless, I really wanted to show you these images because I find them very impressive. It's fetal cardiac MRI with Philips SmartSpeed. This is a fetus with a hypoplastic left heart syndrome with disbalanced AV canal within the uterus of the mother. This is the conventional sequence with an acquisition time of 12 seconds. With the Philips SmartSpeed sequence, we are able to reduce this acquisition time from 12 seconds to 9 seconds and increase image quality. If you then apply the AI denoising, you have beautiful images without nearly any noise, and you don't lose any information. I want you to pay special attention to those muscles. You can very well delineate them here in the denoised image. It's much better here in the AI denoised and Philips SmartSpeed image. So this is kind of an outlook into the future. With this, I want to thank you and conclude that Philips SmartSpeed reduces acquisition time, reduces artifacts, and enables similar or higher image quality. Thank you very much.
My name is Barbara Upland. I'm the MRI clinical specialist for the Wellstar Health System located in Metro Atlanta. Philips SmartSpeed is more than just AI reconstruction. It uses compressed sense for acceleration. Compressed sense is used to accelerate MR scans and maximize the speed. AI construction is employed for denoising the sequences that were previously compatible with compressed sense. Philips SmartSpeed also delivers speed and image quality for non-Cartesian scans like diffusion scans, radial acquisitions like multi-vein XD for motion control, and CMAC for metal artifact reduction. These are the different packages that are included in SmartSpeed. We have the SmartSpeed Spine and Neuro, SmartSpeed for MSK, the Body Pro, Cardiac, and there's also SmartSpeed Motion Free, SmartSpeed Motion Free for the body, SmartSpeed 3D Free Breathing, SmartSpeed for implants, and SmartSpeed Diffusion, as well as SmartSpeed Diffusion for the body. You can see some images there across the board, neuro, MSK, body, and cardiac images. So we began our journey with this with the brain. That is, we do a lot of neuro work here. And you can see this was a graph just of the time savings. And this was an initial startup where we were very conservative with how we implemented it. So we have a total scan time on our brains at 13 minutes, and that's about a 14% savings over where we were. As we've gone along, we've actually kind of pushed those limits a bit. So you'll see this is a flare image that on the left is compressed sense over here at a factor of 1.2. And the IR delay on this was 2,500. That was a 3-minute scan. But over here, we used CSAI, bumped it to 2.4, which was twice the factor. And we also increased the IR delay time. And I don't know if you can see it in this. There's better white-gray matter differentiation, but the scan time dropped to 1 minute 40 seconds, and it's actually a better image. We applied it to diffusion in the brain here. Actually helps the appearance of the ADC maps that we use. So that for diffusion was a big plus there. For the spine, this was a typical lumbar spine with and without contrast. We were at 26 minutes. This dropped at 50%. We're down to 13 minutes, and that's these are all the sequences that we do run. I will say too that as we've continued to use this and implement it, we are using different denoising factors, which enables you to kind of crispen the image, or if you want more detail, or if you need a smoother image. So we have made some improvements here just in the last couple of weeks too with the appearance of the images on these. So we continue to kind of press the limits on this. Here's a couple of images. This on the left is a compressed sense factor of 1.3 with an NSA of 2, which was 4 minutes, 24 seconds. We applied CSAI at a level of 2 with an NSA of 2. It dropped it to 2 minutes, 53 seconds. So we saw some savings there, and we're seeing even more than that now. Here's another option, is motion free. This image implemented motion free. Now, we've known motion free imaging in the past as multi-vein XD. This is a bit different in that it uses Cartesian matrix, where in the past with multi-vein, we got shutter marks on the image, giving you the impression it was a round shutter all the way around the image. With this, with motion-free, we use it's more of a Cartesian look where you don't get that cutoff in the periphery. Here we go in the abdomen, and this is kind of an explanation of what I just told you in the spine. This is your typical multi-vein image, multi-vein XD. It's a T2 with a compressed sense factor of 1.3 and an NSA of 1.3. This image of the pelvis was 2 minutes, 44 seconds. Now over here, we implemented motion-free, compressed sense of 2, and NSA of 1.3. The time didn't drop much, but you can see the image quality is better, and we don't have that shutter effect going around the image. Here it is in the abdomen. Two different options for dynamics in the abdomen. This is a compressed sense image using M. Dixon. The scan time was 13 seconds here. And over here we have a CSAI, or a SmartSpeed dynamic, implementing eThrive. The CSAI factor is 6, NSA of 1, and it dropped to 10 seconds. Again, here's a T2 of the abdomen. On the left, we've got compressed sense at a factor of 2.2. This scan time was 6 seconds. Over here on the right, we have a compressed sense AI image that was bumped up to 4, NSA of 1. This was 6 seconds also, but there's been an increase in the ability to see smaller vessels. If you compare the two images, you can, especially right up in this corner, you can see some very tiny vessels right in here that you weren't seeing over here. We've implemented SmartSpeed on cardiacs. This is a 2-chamber view. This is a breath hold that was 21 seconds. We implemented CSAI that dropped to 18 seconds. And I will say we're pushing those limits quite a bit more as well. We have our balance sequence, which is what this is, Cine, down to less than 10 seconds. Here is a 4-chamber black blood image, and these are 28 seconds. This is for a stack, and over here, 28.4. But what this is doing for you, and I'm not sure that you can appreciate it here on the right, these have the SmartSpeed applied to them. The image quality is a lot better. It's a lot sharper image. I'm not sure that you can appreciate that from this, but it's a noticeable difference. And SmartSpeed Ortho. Here's an example of long axis foot, compressed sense factor of 1.9 over here. Over here, it's at 2.9. This is the same, just pre and post contrast. We did a direct comparison. This scan time is 3:44. This scan time is 2.37, NSA of 2, but you do not lose any detail on this at all. It's sped things up quite a bit for that foot. Here's a comparison between different levels of compressed sense and SmartSpeed. This compressed sense was at 1.7 for 5 minutes. This one was at 2.3, implementing SmartSpeed for 4 minutes, and we bumped it to 2.7 for 3:58. Again, we're running a little bit faster than that now at this point in time. Resolution is higher, 0.48 by 5:1, than these two images. So we're getting better resolution in a faster time. This is an image of the center where we have SmartSpeed implemented. We have the dual screen system, and you can see the magnet in the background there. So in conclusion, the SmartSpeed has reduced our acquisition time, reduces artifacts, particularly with motion-free, and enables similar or higher image quality